Hi, my name is Dr. Michael Messina. I am an orthopedic surgeon specializing in shoulder and elbow surgery, and I'm going to talk to you a little bit today about shoulder replacement. I'll spend a little bit of time just talking about why do we do shoulder replacement, how do we do shoulder replacement, and then I want to tell you a little bit about how the technology has allowed us to really improve some of the techniques and how I think it's making us better surgeons. So let's get started. So first and foremost, what is a shoulder replacement? And again, fundamentally, why do we do a shoulder replacement? So shoulder replacement is a procedure that is used to treat arthritis of the shoulder joint, very similar to hip and knee replacements that are done in the lower extremities. And basically, arthritis is a problem that occurs when the cartilage inside the joint starts to wear away. So cartilage is essentially a smooth surface on this picture here of this healthy shoulder. You're seeing this sort of bluish colored smooth cartilage surface that allows the joint to work and glide the way that it should. But as you see here, as that cartilage starts to wear away, you start to get some irregularities in that surface. You start to get some underlying bone exposed, and as the bone rubs together, that's what starts to cause pain and ultimately leads to dysfunction and decreased quality of life typically. So this is an example of what a shoulder replacement would look like. And so this procedure is performed typically with an incision in the front part of the shoulder. And essentially what we're doing is we're removing those old worn out joint surfaces, and we're replacing them with artificial surfaces, typically made out of metal on the ball side and then plastic on the socket side. So this is just one representation of what a shoulder replacement might look like. And so in terms of when we're performing this surgery, what are the goals? What are we really trying to achieve? Well, fundamentally what we're trying to achieve is we're trying to restore as close to normal anatomy to the shoulder as we can using these artificial prosthetic implants. And so what we're seeing here, this picture here on the left is just a normal x-ray of a shoulder, no arthritis, no problems or anything like that. And this is a picture of a shoulder replacement I performed not long ago, which I think is a good representation, so you can kind of get the idea that we can, with some of the newer implants and newer technology, we can do a pretty good job of recreating pretty close to a normal appearance of that shoulder joint. So then, what are some of the challenges that we face? So this gets a little bit technical here, but I'll try to explain this pretty simply here. Basically what happens is that occasionally with shoulder arthritis, when the joint wears out, it actually wears out asymmetrically. And so what we're seeing here on this picture in the top is this is an example of how the back part of the shoulder socket has worn more than the front, right? So if you look here at this one, this is kind of a very normal appearance of the socket, a more symmetric appearance to the socket. But here you can see that back piece is essentially just worn right off. And when that occurs, you're going to lose bone in the back, and then you start to get something called retroversion, where it almost looks like the socket is facing backwards. And so that creates challenges because, one, there's less bone there to work with. Two, it's actually more difficult to kind of get in there and see because you're coming in from the front. So if it's facing backwards, it's kind of like it's looking away from you, so to speak. And it also creates challenges with putting our implants in and getting them to restore that normal anatomy. The other thing that we see in these instances when the socket wears out in the back is we tend to see the ball shifts toward the back. That's called subluxation or posterior subluxation. And that's what we're seeing down here. This is a normal shoulder joint, where you see if we draw a line right down the center of the socket, it goes right down the center of the ball, splits it right in half. But here in this shoulder where you have this wear in the back, when we draw that same type of line down the center of the socket, you can see the most of the ball is now towards the back because it's actually starting to sort of slip towards the back or subluxate out the back. So these are all things that make shoulder replacement more challenging and can impact the longevity of the shoulder replacement if we're not addressing these things and trying to correct them. So this is where the technology comes into play with the newer technology that we have, we can use CT scans to create three-dimensional imaging of each individual patient's shoulder. So this is an example of a patient of mine, what it would look like once we get that imaging and we use our software to create this three-dimensional picture. And then based on that, we can first and foremost plan how we would like to do the surgery, plan how we'd like to put these implants in. And if we really need to, in a really more technically challenging case, we can actually order customized patient-specific guides that are made just for that person that help us to put these things in the way that we've designed them to go. So this is what a guide might look like. And here we get a sterile three-dimensional model of that patient's shoulder that we can actually have right there at the time of surgery to make sure that we're doing this exactly the way we had planned to do it. So when we're planning the surgery, here's some more examples of what that would look like. So again, we have an example of a shoulder where the back part of the socket is worn a bit more than the front. You're seeing again this line down the middle, and the ball is shifted towards the back. So this is exactly that example that we had talked about. And now what you see is that we can use the technology and the newer implants that actually have the back part made a bit thicker, and that's going to allow us to actually restore that socket to a more normal position. So basically, there's more worn in the back. Well, we're going to put more there as we do the replacement. We're going to sort of build that back up, and we can bring this back out to a more even or non-retroverted position. And that's essentially what we're trying to do, what we're trying to achieve. And so what does that look like when it's all said and done? Here's an example of a patient that had that situation, had that implant, and here's the x-ray after it's done. And I think what you can get the idea of here on this x-ray representation is that, again, when we draw this line, whereas this patient, before, as you remember, had that shift, that posterior shift, that subluxation back, well, now you're seeing that we've been able to restore that balance into the shoulder, and the line is going right down the center again. And you can even see here how our implant is a little bit wider, a little bit thicker, I should say, in the back than it is in the front, which is helping to sort of rebalance the shoulder there. So that's kind of what I wanted to show you, and that's pretty much all I have for you today. I hope you found that interesting, and certainly if you have any more questions or anything like that, we'd be happy to answer those at our office, or certainly take a look or address any type of shoulder problems that you're having. Hope you're take care.